I'm just posting my final video for during week 8. I can say that I learned a lot throughout the last 8 weeks. This was my first master's class, so I kind of felt like I got bombarded with an 8-week class, but I think overall it went quite well. The 3 issues that I think I liked the best or learned the most from was probably the entry to practice was number 1. And I know I mentioned it in the first video that we posted, I believe, in week 4. I took kind of the untraditional route when I got my nursing license. I started initially as a paramedic, went to the ADN through a bridge program from ADN to my BSN, and then currently obviously working on my master's program. I feel like I know a lot of great ADN nurses, and I think it probably depends on where you go to your community college at and probably what background you have prior to that. I would trust any ADN nurse that was a paramedic prior to that probably any day of the week compared to a lot of BSN nurses. However, with that being said, I do think that in the wave of the future that we will be going to the BSN. Obviously, with the 2020, the goal is 80 or 85% to be BSNs in the hospital setting. I don't feel like, though, that we need to 100% eliminate the ADN program. I still think that has its use. And I think that the only way that we will continue to have staff is to continue to hire ADN nurses. If I remember right, from week 2 or 3, they're projecting in the next 10 to 12 years when the baby boomers retire that we'll be losing over 1 million nurses. And the BSN programs that we have this day and age will never, ever be able to produce that kind of nurses within the next 10 to 12 years. So we'll have to utilize ADN nurses. And like I said earlier, I think that there's obviously a place for ADN nurses. Being in management, though, I do still hire ADN nurses, but I do push all of my ADN nurses to continue to go back to school and complete their BSN. And it's nice that we are able to offer tuition reimbursement, so it's not much of a cost for them. It's more just of a time commitment. The second thing that I really liked was probably ICS, or Incident Command and Mass Casualty Incident, which I think we discussed in maybe week 3, if I remember correctly. I am a huge emergency room fan. That's all my background basically was ER, which I think comes along with the whole Incident Command thing, because we are kind of the second step in line if there ever is a huge mass casualty. You've got the pre-hospital workers that bring them into the ER, and we're kind of the first line in the hospital or second line in the whole incident. I feel like all nursing staff, in fact all hospital staff, needs to take some sort of an ICS class, either a NIMS 100, a NIMS 200. They're not difficult classes, but I think that they're extremely beneficial if we do ever run into that risk of having a mass casualty drill. This way everybody continues to be on the same page. Back in the day when I was on the ambulance, we used to use a lot of 10 codes. And with the new ICS and the NIMS courses, they have eliminated all of that. Now it's just plain English, which a lot of people still don't even realize that it's just plain English talk on the radio. And a lot of nurses, surprisingly, when we have these drills at my hospital, a lot of the nurses don't even know how to talk on a radio, which is shocking. So I feel like all hospital staff needs to continue to go through incident command training, NIMS 100, NIMS 200, and they need to participate in at least one drill a year to stay proficient at the skills of what they learned when it comes to the NIM classes. My last thing that I really cared for is cultural competency, and I think that's just because I'm a big fan of learning numerous different cultures out there. Not just religious and locations, and we have a big push right now with LGBT at my hospital, and we require all staff to go through about 2 hours a year, and I think that's part of cultural competencies. Things are changing. We are truly a melting pot here in the United States, and I think that we will continue to be that. And I think that it's good to be able to open your eyes and open your mind and accept anybody and everybody. And I feel like the hospitals need to continue to push those yearly educations to their staff members. But I think overall those 3 are my big ones. You talk about the 5 C's of caring and compassion and the rest of the other 3, but they kind of go into really all 3 of those items. And I think as nurses, you have to carry all 5 of those. And if you don't carry and use all 5 of those, then maybe nursing probably isn't necessarily the career choice for that individual. So I'm glad I took the class. I learned a lot, and I'll be forward to my next class.